Okay. Hi, Jessica. Now that we've had the time to complete the assessment, I'd also like to take some more time to go over your scores with you, if that's okay.
Okay, sounds good.
Okay, so as we just went over um, the assessment, you noticed that it asked a lot about your drug use and frequency of drug use.
Hmm.
And based on your scores, you actually scored um, low to no risk for cannabis use. You had mentioned that you've used it in the past and occasionally, but you are at no risk for that as of now. Um, your There was a moderate risk for your score with cocaine,
Okay.
and you did have a high risk score for your alcohol use.
Okay.
Um, and based on these scores, I would like to offer some brief intervention and possible further um, intervention options for you based on what you'd like to accomplish
Okay.
with this program.
Sounds good.
Okay, now some information on alcohol. I do want to inform you on some of the possible harms, and because it is one of your high risk scores, you may be experiencing some of these um, more more times than not,
Okay.
depending on how often you're drinking and the severity of it. But the most common are hangovers. After a long night of drinking or a long day of drinking. You might also experience, your behaviors change. Might be more aggressive, a little more violent sometimes. You might also be more prone to accidents, not just if you choose to drink and drive, but also just walking down the street, maybe around in your house. Dizziness. You might be you'll be more at risk for injury. Um, Also, some of the more medical concerns that people experience with heavy alcohol use is inflammation of the pancreas and also high blood pressure. And um, also, just so that you're informed, inflammation of the pancreas and harm to the liver causes people to go to the emergency room and that need more immediate medical help.
Okay.
Um, Yeah. Do you have any? What are some of your thoughts on some of these harms that alcohol
Well, I
use?
mean, the ones that stand out to me are more of like the violent behavior because I have noticed that when I drink, I end up getting into fights with my mom
Mm-hmm.
and with my sister. Also, it's been physical a couple of times. So that's mostly because they're bitching at me that I'm, coming home and been driving my car and stuff. But, so I think those are the ones that kind of stand out for me. And then I know I also have been having I know I have diabetes, so I know that alcohol is also not good for me because I have diabetes, and I've been having a lot of problems with my stomach,
Mm-hmm.
and I even had like it's like this really extreme like pain, and haven't gone to the doctor yet, but it's just things that have been on my mind.
Okay.
And I'm not sure if it's because of the alcohol. I don't really think so, but other people have told me that it could be. So I don't know. It's just I don't know.
Okay. So some of the things that I understood based off what you said right now is that it's leading to aggressive behaviors with family. They sound like they're concerned with some of your drug use, and it even sounds like people have even mentioned that they're concerned with or that they're hoping that you might change some of these behaviors based on them telling you um,
That
that
it's
drinking alcohol leads to some of these behaviors, and they sound concerned.
yeah.
Mm-hmm.
Yeah, I think they're worried for me. I think I don't. Yeah, they've been worried about me.
Um, okay, so do you have any more questions on some of the harms that alcohol or your cocaine use might bring?
Do you know? I do have a question. Do you know? Does alcohol can that cause um like some type of cancer? I don't know if you would know. Is that true? I've heard about that.
Yeah. alcohol can cause some cancers. I actually don't have information on what specific cancers, but I will get that information to you as soon as um, either this session is done or possibly for the next session. I will provide that information to you.
Sounds good. Thank you.
So now that I've provided you with some information, I'd like to know, some of your willingness to, what are your plans based on your drug use right now. So, what is your concern with your score, knowing now that you did score a high risk for alcohol use?
I don't, I'm not too surprised. I think
Okay.
that, like, I kind of am and I'm not because I didn't think that it was that big of a problem. But I know other people tell me all the time, like, they complain about my drinking. And so, yeah, so it's kind of not a surprise. I already kind of knew that it was a problem, especially with, like, the issues I've been having at work. So, but I was surprised about the cocaine score because I don't think that's a problem.
Okay. So, it sounds like you were kind of expecting to hear that alcohol was was the most concerning drug use right now. Cocaine not so much, since you mentioned that you do it occasionally and you really don't see it affecting your life right now. But as for alcohol, you did mention that your job sometimes you notice it being affected from your alcohol use and some of the um, complaints you hear from your family, um, that because of that, it didn't seem like to you alcohol was of great risk.
Yeah.
What about if we explore your willingness to want to change some behavior, since you are concerned with your alcohol use? Um, what about um, what do you think some of the benefits are of continuing to drink alcohol?
Well, of course, that I still get to hang out with my friends and that I would have, like, things to do. I just can't, like, I would be bored without it. So,
Okay. What about what are the costs of you continuing to drink alcohol?
I'll still have problems with my mom, and I'm gonna still, like, continue to spend, like, a lot of money
Okay.
on alcohol.
Okay. Um, so let's say if you were to wake up tomorrow and things were exactly how you'd want them, what would that look like for
I guess maybe I would, like, not drink as much alcohol as I do.
you? Okay.
Maybe it would be like once or twice a week.
Okay. And since you mentioned that you would like to cut back on your alcohol use, um, what would you score your willingness to want to stop alcohol use? One being that you're not willing to start tomorrow, you're not ready yet, and 10 being that you can start right now. You'll start informing people on your change, and that you'd like other people to help you with cutting back.
I would say like a 5.
Okay, so that sounds like it's in between. So what do you think it would take to get to a 6?
I think maybe like having my mom, instead of like putting me down, like maybe like supporting me more, and like, you know be open to, like, maybe coming or giving me a ride to,
Okay.
like, places I need to go to
Okay.
get help.
So having that support from your family members would really increase that motivation and willingness that you need to cut back.
Yes.
Okay, so now that I've given you information on the drugs that you do use, I want to provide you with options for your high risk drug use, which was alcohol. So you do have options for support groups such as Alcoholics Anonymous. It is a 12-step type program where you can go to feel supported by other people who do identify as alcoholics and hopefully give you that motivation that you need. There's also um, depending on your medical conditions that alcohol might be affecting right now, there's also like inpatient care that can support your body's like physical needs and make sure that you're getting the help you need in order to cut back if you do think that you need to start um, cutting back immediately.
Well, I don't think my problem is that bad that I will need to go somewhere, you know. But I think I'll be open to like going to like those groups. I've heard about them, so I mean, I just don't know where to go. Like I don't know, so.
Okay. We can definitely give you some more information on places nearby where you might live um, or near your job so that you can have that accessible to you and hopefully start to see some changes based on what you said today.
Okay, that sounds good. All right, Christina. Well, thank you for meeting with me again today. As you know, we're gonna go over the scores for the assessment that we conducted.
Mm-hmm.
And so, you know, usually I know that I asked you a lot of questions about your substance use, and usually the way that we rate them, we score the use of substance in 3 levels, which
Okay.
is low, moderate, and high. Okay, so low would mean that you know that it's not a big concern. You don't have a lot of risk of developing any problems because of your use of that substance. If we rate it at a moderate level, it means that you are at some risk of experiencing health or other problems from that current substance use. And then when we rate it as high, it means that you're at very high risk of experiencing severe problems like in your health, social life, financial, legal, or your relationships as a result of your use of that substance. Okay.
Okay.
So, in looking at all of your scores, you know, we determined that the assessment determined that you were at moderate risk of for 2 substances, right? So cocaine and alcohol. So what I would like to do at this time is to give you just some information about like the effects of those 2 drugs. And like I said, right now we don't deem that as like you're at very high risk, a moderate risk, right? But we still like to just give you some information so that you can have that. Is that okay with you?
Yeah, that's fine.
Cocaine, there's also, you know, some side effects that include difficulty sleeping, like potentially your heart could be racing. You could develop headaches, weight loss, mood swings, anxiety, depression. Just want to be able to provide you this information so that for your knowledge, you know, so that you can know. Okay, so now as far as the assessment, there was one substance in which you rated high, very high, right? So I'd like to, you know, we're going to take a little bit more time to go over that, and that's the one we want to focus on, okay?
Okay.
Because again, when we rated high, it means that you're at like a very high risk of experiencing problems as a result of use of this substance. And in your case, it was crystal meth, okay? As you mentioned, you know, that you've been using meth for some time now, and so some of the effects that I'm going to go over, you might already know, right? And, you know, but again, it could include like having difficulty sleeping, loss of appetite, losing weight. It could be like, you know, you could have legal employment problems. Your ability to function, like in a day-to-day, can be affected. As you know, you can also have like mood swings, anxiety, depression, panic attacks when you're like, you know, coming off the drugs or when you're while they're in your system. A lot of people also experience aggressive behaviors and psychosis in some instances.
Okay.
You know, and some of the more permanent and damages that can occur is like permanent damage to the brain cells and liver damage, and for some situations that people can overdose and die because of this drug. Okay.
Okay.
So again, we just want to be able to provide you with this information and give you your scores. Okay. And so, Christina, do you have like what are your thoughts about like the scores and the information that I just gave you?
I think that I can definitely understand the high risk of my crystal meth use. I really don't like the difficulty sleeping. You know, I'm up for days sometimes, and I have noticed that I'm beginning to look very thin, and I think that people are starting to get concerned with how I'm looking physically, and it's leading to a lot of people to be really worried about me, and I think it's really difficult for me to stop. But yeah, I do think that I'm concerned with my crystal meth use.
Okay. All right. Well, it does sound like there are some things that have been on your mind that that you've been worried about, and then perhaps like other people have also brought it to your attention, and been worried for you too, right? And as you know, with like any substance, there's sometimes like there's some benefits, right, to using, and so we also like to get to know like that side of use, right? So can you tell me, are there anything any pros to your use? Are there any benefits that you feel like that kind of beneficial to your life?
Yeah, I think that like although it leads for me to have some sleepless nights, I think that it also I can use that time to like really get stuff done for work. I'm up cleaning. I'm able to keep my house looking normal, although I do have obviously I'm using this drug pretty often. So I think that that's some of the benefits, that I just get this energy that um, it just it keeps me active.
Okay. Okay. So on one hand, it sounds like you do have some benefits. You have energy. You're cleaning your house. You're
Mhm.
active. You feel that high energy level, right?
Yes.
But on the other hand, also heard you say that there is that you're worried that you're losing a lot of weight, that you're not sleeping well, and that other people in your life are worried for you. So it sounds like there's a little of both going on.
Yeah. I think I've never thought about some of these things before. I've never really pointed out the benefits and the risks together. So this really helped right now.
Okay. Sounds good. And so, Christina, we also like, always like to kind of see where you're at, right? And so, um, in like your willingness, to change some of these
Mm.
behaviors or some of your use, right? So when thinking of your either reducing or stopping crystal meth use, right? Where I'm gonna ask you a question from a 1 to a 10, with 1 being not ready to reduce crystal meth use or stop using crystal meth at all, and 10 being like I am ready to stop using crystal meth today or reduce my use of crystal meth today. Like, where would you say that you would put yourself from a 1 to a 10?
I'd say that I'm at a 6. I think that um, a few days ago or a few weeks ago, I could have possibly even been less motivated. But I think over the past few days, I've really seen how it's affecting the people around me. So I think they're the reason for why I'm at a 6 right now, and I'm leaning more towards stopping my drug use.
Okay, so it sounds like there's some motivation there. And what would it take for you to get to, let's say, like an 8 for you to stop using?
I think I'd really have to think back to how my life was before I started using crystal meth. And right now, I really don't see the positive in my old life. So um, I think possibly like seeing some of the benefits of how I used to be, I think that might lead for a greater motivation. But as of right now, I really don't. Um, I don't like the life I used to live.
Okay. So potentially, it sounds like exploring ways to live your life without using crystal meth, but also not letting it go to what it used to be. It sounds like you weren't very happy with that. So
Yeah,
maybe exploring new ways to live without crystal meth could get you to that point where from a 6 to an 8.
yeah, definitely.
Sounds good. Okay, so part of what we also do, Christina, is we want to be able to provide you, like I said, with information which we've given you on the effects, and also give you information about referrals and like potential, potentially things that you could do, to help you reduce your use of crystal meth, right? Or stopping completely if that's what your goal is. But so part of it could include, narcotic anonymous meetings. I don't know if you've heard of those before.
I have. A friend has mentioned them to me.
Okay, so perfect. You know that these are open to the public, and you can attend completely anonymously, and you don't have to. They're everywhere. They're in many places. Another program that we other intervention or another type of help that we can offer is also entering like an outpatient program where you would receive information about help and support about how to reduce or eliminate your use of drugs. And there's different programs, outpatient, right? So it would be you can come and go a couple of times a week and receive the support. And lastly, what the third option would be entering an inpatient program, right? Which is what I would recommend at this time.
Okay.
Because of the length of time that you've used and the severity of what you've reported to us. So I think that obviously the decision is yours. Whatever it is that you want to do is completely up to you. But we want to be able to support you in whatever that means. So for the inpatient program, we have people that can come and give you additional information about what that would look like. So what do you think?
I think I'd like to hear from people who have been through the inpatient program just to see what their experience was. I think right now I don't know a lot about it, so it makes me feel kind of worried.
Okay, that's fair. That sounds like that's something we can definitely look into it and see who could potentially can give you more information about that. So we will continue to work together and get you more of that information. Sounds good?
Yes, thank you so much.
Thank you, Christina.